Hey, welcome everyone. Glad you could join us today. We are recording our session, so for bandwidth and for the recording, we do ask everyone to turn off their cameras and mute themselves during the presentation. I will be monitoring the chat, so you can share any questions you have there, and I will share them with our presenter. Melody Alcazar is running tech for us today. Thank you, Melody. As I said, we are recording today's session, and Alice will follow up with an email with that recording in a few days. If you are uncomfortable with your name showing, you can change your name to anonymous and then private message Melody with your name for our attendance. Also, please, if your Zoom name does not match the name you registered with, please change your name in Zoom or let Melody know so we can make sure we have it in our attendance. I'm going to go ahead and do our land acknowledgement. Texas Children in Nature Network is headquartered in Austin, and as such, I'm on the ancestral and unceded land of the Tonkawa, Comanche, and Sauna people. Our ongoing colonial presence on indigenous lands compels us to take action now to counteract the effects of colonization. The work we do through the Texas Children in Nature Network is one small step towards that effort. In just a moment, I'm going to put a little bit in the chat about land acknowledgements and about those people groups. And then I'd like to go ahead and welcome our speaker today. Dr. Deborah Kellstedt is with AgriLife, and she's going to be talking about park prescriptions. Thank you so much for joining us, and I'll let you take it over.
Thanks, Sarah. Good afternoon. It's good to see so many of you logging in today on the Zoom. Thanks for joining us, and thanks for this opportunity to let me share some of this information about park prescriptions for better health. My name is Deb Kellstedt. I'm an assistant professor and an extension specialist in the AgriLife Extension Family and Community Health Unit, which is part of the Texas A&M system. A lot of my work has focused on improving health by promoting physical activity. And I've kind of looked at that at all stages of life. I've done some work with children all the way up through older adults. But most recently, especially in the past few years, and a lot of this even prompted during that pandemic, I've started to look at that intersection between being in nature and being active, and how together those two things can really improve health, and not only improve physical health, but also helping to improve mental health as well. So before I get started, I just wanted to acknowledge some colleagues. I'd like to acknowledge my colleague Jay Maddock, who works at the Texas A&M School of Public Health, who's doing some work in this area, and specifically to acknowledge one of his graduate students, Whitney Niggle, who's really helped a lot with the background research for this talk. And so I just really appreciate the work that they're both doing in this area. So in the next 45 minutes or so, I'm going to start by talking about some of the health problems that we are facing today here in Texas. And then I'll share some research about how we can address those problems, and then describe a real nature solution through the form of a nature prescription program, and give some examples on what exactly that is. There's a lot of information floating around about Park RX, park prescriptions. So I'll talk about what that is and give some examples, because it can be really confusing. And then I'm going to wrap up by talking about how we, perhaps together, can think about designing an ideal nature prescription program for Texans. So like I said a few minutes ago, I work in the field of physical activity research and physical activity promotion. So I always start with this slide because over the years, we've had a lot of programs, we've had a lot of strategies trying to help people get more physically active. And not just adults, we're also working in the area with children too. But what you can see from this figure is that things have not really changed over time. Back in 2011, we see about half of adults in Texas were meeting physical activity guidelines, and then all the way to 2019, we're still right around the same mark. So these guidelines are actually national physical activity guidelines that recommend that adults be active in moderate to vigorous
just a
physical
moment.
Yep.
We have some people who can't see the slides. I can see it, but maybe we can try a stop share and reshare, see if what's happening.
Okay, I will go ahead and try to stop share. Just a moment. Okay.
Okay, I can see it. So if you still can't see the slides, please let us know in the chat. Okay, it looks like it's working now.
Okay, perfect. Okay, so what I was saying is that things haven't really changed over time, that we're recommended to get 150 minutes of physical activity, but in Texas, about half of adults are still at that same level. And in reality, those percentages are probably even smaller because we tend to over-report how physically active we are. So things have really stayed the same over time, even with all the programs that we're implementing. So not only are we not as physically active as we should be, but we're also spending a lot more time connected to media. And we can see this data over time as well. Research has shown that adults in the US are spending an average of 13 hours and 21 minutes a day on their computers and their phones, televisions, listening to the radio, and a very small amount of that time even reading media. So again, this is a concerning figure, just showing really how we are spending our time. So if we're not using it to be active, perhaps most of our time is spent inside, sitting in front of some sort of media. And then over half of Americans report spending just 3 to 5 hours a week outside in nature. So initially that doesn't seem so bad, but that's about less than an hour a day outside. And the good news is those numbers changed during the pandemic. We saw some increases in time spent outside. And so the real question now is, you know, how did that impact people's health, and are those numbers going to stay up, or are they going to go back down to where they were before the pandemic? And then what do we see with children? Well, we're seeing some of the same data. Children today are spending 7 to 11 hours per day sitting with media. So 7 to 11 hours per day with cell phones and tablets and computers and televisions, and only minutes a day being outside. So that's really concerning and really has changed over time. Since the 1970s, children have lost roughly 12 hours a week of free time, and that includes a 25% decrease in play and a 50% decrease in some of the unstructured outdoor activities like running in a field. So we're seeing some of the same problems happening with children. So what happens when people aren't active and when they're on their screens and when they're inside all day? Well, one thing we're seeing is this rise in obesity rates. Despite all the physical activity and nutrition programming in the US, the obesity rates are still going up. And this is from 1970 to 2010. But as of 2017, 107 million Americans were reported to be obese. And obesity and lack of physical activity can lead to a lot of short-term and long-term physical health problems like type 2 diabetes, heart disease, high blood pressure, even some types of cancer. 133 million Americans are currently suffering from some of these chronic diseases like this. In addition to the physical health problems I've talked about, there are mental health problems that are increasing too in the US. Over 16 million adults have an episode of depression each year, and then we're seeing a skyrocket in deaths of despair in certain groups, including less educated white men. We see this increase of these deaths due to drugs and alcohol and suicide. So this is definitely a mental health issue as well. So what can we do? That's a lot of problems. I hate to start talks with all of that, but usually it's good to kind of lay the groundwork for where we're at. Well, one solution to this problem is to get outside. It seems pretty simple, but what we saw during the pandemic is very promising, that more people were getting outside in nature and that there were a lot of health benefits. And there's a lot of research to show that there are major health benefits to being outside and to being in nature. So I'm going to pause here. We're going to see if this works. I always love people to participate, and sometimes it's hard when we're in Zoom and Teams to talk. So if you would like to share, you can go ahead and use your phone and scan the QR code on the screen, and it should take you to a link that brings you to a little poll, or you could go directly to slido.com. And if you type in #nature, then you can answer this question. What words come to mind when you think of nature? And you can just start typing in as many things as you can think of, and we'll see what people say. Hopefully it'll work. Aha, we have a participant. Fresh air. Okay. Birds. More people saying fresh air. Yes. Trees, birds, mosquitoes, rain, yeah, greenery, green, this is great. Keep going if you have more to say. I think what's really important to note about something like this is that nature means different things to different people, right? Some people might feel really connected to plants and trees. I'm not sure if I see anyone who's got a connection to water. Some people enjoy wildlife and birds, and some people think of negative things when they think of nature, right? Mosquitoes and bugs and snakes. So it's really, when we think about nature, when we start talking about nature programming or nature prescriptions, it's really important to think about what it means to different kinds of people. So thanks for participating. We'll have another slide like that in a few minutes. So like I said, there's a wealth of research on the benefits of nature on human health. Getting outside in nature can reduce stress. It can help you get better sleep. It can improve your mental health, your life satisfaction. It can help with some of the physical issues we talked about, like lowering your blood pressure, increasing your immunity. There's a lot of research to show that when you're in nature, you're more likely to be physically active. And when you're more physically active, that can help with some of those problems with obesity and risks of chronic diseases like diabetes and heart disease. So all of these benefits are really important to consider when we're talking about recommending nature to people. And even going outside for a few minutes during like a stressful situation, it can really help you restore your focus and help you feel calm. I've talked to early childhood educators, and they talk about how, you know, when a child's having like a meltdown, sometimes if you just take them outside for a few minutes, it really helps them to calm down. So nature has this really calming effect on people, and it has a lot of health benefits that have been shown. And it kind of goes back to this concept of biophilia. This is a word that was coined to mean kind of a theory of how connected all humans are to each other and to nature and to other species, and that we really need nature. We need it as a part of our everyday life. So being in nature on a regular basis really is a medicine for being healthier and being happier. In fact, spending time in nature is becoming recognized as just as important to health and well-being as diet and sleep and exercise. How often do you go to the doctor and they talk to you about what you eat and how much you sleep and how active you are? But now globally, the idea of asking people how connected to nature is becoming more prominent. This is becoming something that is an important part of assessing people's health and their well-being. So one way to get people all those benefits that I just talked about from being in nature is to prescribe nature. It isn't often until people start to struggle with a physical or mental health issue that they'll go seek medical care. And most often, solutions to medical issues are a medication, right? A prescription or some type of treatment. Well, a nature prescription holds promise as one solution to some of these health problems that we're facing. In fact, the recent U.S. National Physical Activity Plan recommended the use of these kind of nature or park prescriptions. Nature prescription programs are diverse and they're changing. They often include the collaboration between park and public land agencies with healthcare providers and then some community partners as well. People often refer to all these different types of programs as Park RX. But there are actually between 80 to 100 nature prescription programs across the United States. And some of them are called Park RX, some are called different things. But I think sometimes that's the most common way people think about it. In talking to Whitley, the graduate student, she was the one who said, you know, nature prescription is really a probably better description for this than a park prescription, because it's a more broad understanding of how we can access nature. Not everyone goes and gets nature in a park. So I like that too. I like that thinking about the words nature prescription more than just parks. So what is a nature prescription exactly? Well, a nature prescription program usually involves a healthcare provider, you know, like a doctor, nurse, social worker, talking to a patient, maybe about some of these chronic disease problems or health problems, and reviewing, like if it were me, reviewing my health data and my daily routine. And a nature prescription can fall into kind of two categories. There's more structured categories and unstructured. So a more structured prescription might be one like you see on the screen, where the healthcare provider might discuss some goals and actually gives a written referral to a formal outdoor program or activity. And this one, if I'm the patient, my prescription might be to go for a walk in a park near me. There might be some instructions about what I'm supposed to do before and after, and a dose, how much I'm supposed to get, 45 minutes, Monday, Wednesday, Friday mornings. And then if I need to refill, unlimited, and perhaps even a follow-up with the provider after that. This example is from the Park RX program. This is the actual Park RX with their logo, which I'm going to talk more about in a few minutes. But this is an example of what a more structured approach would look like. And some programs are so structured that they even have the prescription as part of the electronic health record. And certainly some healthcare providers might request a follow-up with patients based on this to see if the patient adhered and what impact it really had on some of the health issues they might have been experiencing. So these are some of the health conditions like a healthcare provider might see in a patient that could be addressed with a nature prescription. A patient with ADHD might be prescribed nature, again, because of that feeling like focus and restoration that can happen in nature. Patients with problems with obesity or chronic conditions, negative mental health issues, depression, anxiety, even things like PTSD and burnout, those can all be addressed by spending some time in nature. And then insomnia, nature has been shown to help people sleep better. So that's another one that can be addressed with nature. I do want to say that that of course some of these issues might require medication and other kinds of treatment. So I'm not saying get off the meds or get rid of all medication, because certainly we don't want to deny people the kind of medications that would really help them. But a regular dose of nature could actually complement what the healthcare providers are traditionally prescribing. And in some cases, it might be able to substitute what they're traditionally prescribing. And not all doses of nature have to be large doses. When we had the slide, a few slides ago about what nature means to you, some of these things might happen in big doses, like a whole weekend camping or hiking, but nature can happen in small doses too. And even small doses of nature can really make a difference. So here are some ideas for getting out in nature. Park visits are probably the most often prescribed, but you could do things like gardening and walking and outdoor sports. They can all get us connected to nature. Forest bathing, I'm not sure this is a term that some of you are familiar with, maybe you are, it's a Japanese term, and it really is a practice of being more fully immersed in nature, using all of your senses. And forest bathing has actually become more common. We have forest bathing programs here in the US. We have forest bathing guides here in Texas. So this is one thing that could be prescribed. I'm most connected to nature through water. I grew up in Michigan, actually. I grew up near Lake Michigan. So I always feel home when I'm on a Great Lake, but near any water. So certainly river, beach, coastal walks, that's going to connect to me. Care farming is another term that you might not be familiar with. This is like the therapeutic use of farming practices for more marginalized or vulnerable groups. So this has been used in like veterans, children with autism. This might be something that would help them. And I like to bring up farming with nature too, because when I give talks about nature with the AgriLife Extension agents that I work with, this is the connection to nature that many of them might have because of where they grew up and what they grew up doing. So certainly good to think about gardening and farming as connecting to nature. Climbing, farmers markets, all these things could be prescribed. And I would like to argue that even spending time like in your backyard or out on, walking in the sidewalks in your neighborhood could connect you to nature and help you get some of those benefits. You'd be amazed if you just laid on a blanket in your backyard for 5 minutes and listened and smelled and looked what you could experience and how you can connect to nature and just even that dose. So all these things could be prescribed. So where are these kind of nature prescriptions happening? I'd like to just share a few examples. There's a lot, like I said, there's a lot of programs out there, but this is just a handful of some that you might have already heard of, or some that you might not have heard of, but there are programs that are on like a national level and on a state level, and then even on more local and regional levels. The nature prescription program that most of you are probably familiar with is, like I said, the Park RX program. This was launched in 2013, and this was one of the first park prescription programs. The words Park RX are used, like I said, to describe a lot of things, but not everything really truly is from this program that's recognized as Park RX. This organization is comprised of a partnership with the Institute at the Golden Gate, National Recreation and Parks Association, the National Park Service, and some other park agencies, along with healthcare providers and some other community organizations. And they all came together with this goal to really support the park prescription practitioners and help them in prescribing nature to their patients. So this is the Park RX logo there at the top. If you go to parkrx.com, you can see there's a lot of resources and toolkits. They're also collecting some data nationally from some of their different programs at different states. So this is the one that's probably the most recognized. These are examples of the states that have implemented their own statewide Park RX programs. This is just a handful. There are more than this. So like Alabama, Virginia, Florida, Montana, California, Massachusetts, and then even more broadly, Washington, D.C. had started a Park RX program, and now it's called Park RX America. Sometimes people happen upon that one and they think that that's the national program, but actually Park RX is the umbrella, and Park RX America kind of falls within that. We do not have an official Park RX program in Texas. Though our colleagues at Texas A&M and some other partners are really thinking about how we might be able to implement a statewide nature prescription program here in Texas, and we'll talk more about that in a few minutes. So this is another example of a national program. This came from a program called Kids in Parks, and they created the Track RX program. This was to help kids and families learn how to spend time in nature as a way to improve health. They partnered with pediatricians and nurses to help advertise the program. And the way they did that was more in this unstructured way. So this was just putting their materials into doctors' offices and community health centers. So this isn't exactly where you have a doctor writing up a prescription. This is more materials are there at the doctor's office in case a family wants to go ahead and take one of these sheets of paper with them. It gives them ideas of what they can do in nature, and then they can log in and register at kidsinparks.com to get prizes and just to be part of this program. So that's a little more informal, but that would be considered a nature prescription type of program as well. This one, Outdoors RX, was this is more of a regional program. This is the Appalachian Mountain Club and Mass General Hospital collaborating on a program that they call Outdoors RX. Now, Outdoors RX would take, they take kind of a unique approach. They're filling these outdoor play prescriptions by removing the cost and a lack of experience as the barriers for families who are new to the outdoors. So they're trying to connect people locally to their urban parks and trails. And so they're providing guided programs that are free, they're close to people's homes, and it's often that first step to getting families and patients outdoors. So this one's to really help overcome some barriers, but very regional. And actually, when I think this was one when I was looking for it, it's kind of changed, and I'm not sure the program is really going on the way it started. So this is an example of a more small local program. I love this program. This is an example of another national program, but it's happening in Canada. It's called PARX. It was launched in 2020 and it's just grown, it's taken off. This is where healthcare providers in 4 provinces of Canada, they can now prescribe free national parks passes to their patients as part of their health treatment. So they give a prescription to be in nature and they give a national park pass to go get in nature. More than 5,000 healthcare providers are using this program in Canada. And this is just a great example of what you can do when you launch something at a national level and provide the funding in order to give people that access that they need to get into nature. Another program is called Walk with a Doc. This is a national program. It's led by doctors at events and local parks. This one was started in the early 2000s, in 2005. It's where a doctor would give a brief presentation on like a health topic, and they lead participants on a walk kind of at their own pace in a park nearby. Throughout the walk, people can talk about their health issues with the doctor, and they're in a more comfortable setting. So this is kind of the, doctor kind of walking the walk with them. Each Walk with a Doc community is asked to commit to doing at least 12 walks a year. So it's a program that's aiming to get people out on a more regular basis, going at least once a month. There's another program that's similar to this that's called Docs in the Park, but both of those would be considered kind of a nature prescription program as well. And some of you may have heard of these programs too. So those are just some examples. Like I said, there's probably more that you've heard of. There's more probably happening locally here, even in Texas. But it just kind of shows you kind of how the different ways a nature prescription program could work. Now, what we've seen with research, though, is there's a number of barriers to how this works. A number of things that healthcare providers report and patients report as to making it hard to do a program like this. So the providers are telling us that, of course, they have limited amount of time with patients. We know this. So it might take even longer if they're trying to sit and talk to patients about the benefits of nature, where they can access nature, how to overcome some of the barriers to be in nature. So that makes it a little more difficult for doctors to prescribe. Healthcare providers might also be concerned that patients are not going to adhere or, comply with the prescription. The weather may get in the way. There may not be enough materials. Also, I think it's important to remember that if a healthcare provider is referring a program outside of the medical system, there might be some legal constraints with HIPAA and making sure that patient confidentiality and stuff like that is protected. So we have to think about those constraints that healthcare providers might be experiencing. And then there might be some barriers for patients. Most of these barriers, like money and time and transportation and resources, really have to do with equitable access to nature and green spaces, and how we can make parks and green and blue spaces really available to everyone in communities. We certainly want to address these issues as we begin to develop nature prescription programs. Ways we can help do that might be to help people know what nature might be near them, help them understand how, nature doesn't always have to happen far away from home. It can also come closer to home, and then helping people build some of those skills to spend time in nature. And then certainly providing ways to make nature more accessible, if that's free park passes or transportation or things like that, to overcome some of these barriers. So I think the key to really successful programming and the key to designing a successful nature prescription program really is partnerships. This is probably the first step, and I think one of the most important steps. Many of us do work aiming to help people live healthier and happier lives. I certainly have that as my goal in my work, but we all do that so isolated from one another, right? We're each in our own silos, we say, and we know that multi-sector collaborations really have so much more ability to affect real change. So if we want to move the bar on some of those health statistics that I shared earlier, it's really, I think, starting to work together that can make that difference. So I'm just going to pause here and let us just share who the partners might be. If we're going to create the ideal nature prescription program, who do you think needs to be at the table? Who are the partners that we should include? If you want to go to slido.com or scan that QR code and just start listing some of your ideas of partners to include in an ideal nature prescription program. We'll take a few minutes to see what y'all think. From Taurus, yeah. Doctors and pediatricians, teachers, health departments, animal control, schools, school nurses, therapists, state parks, extension educators. Yeah, schools, doctors, those are big ones. The zoo, that's interesting. Yeah, these are all of the different groups that I would think of. Perhaps health insurance companies, that's one that I was thinking about too. And maybe even the participants and patients themselves. I think, it's really important when we're designing programs for people that we really include the people that the programs are designed for, right? Giving them a chance to talk about their needs and what they would like to see, what would really help them. So this is great. A lot of good ideas. Universities, awesome. Okay, so partnerships are key. So let's see what else. What else is involved? Well, we do need to decide on a primary goal. When you get a lot of different partners together, we all have a lot of ideas of kind of what we're looking for. And so you really need to all get on the same page. Would our primary goal for a program be to improve health in the community? Or could it be to increase participation in park programming? That's certainly a goal of some of these programs. Are we specific to one population, like children? Or are we thinking about adults or teens or older adults? One of my goals in programming is usually to increase physical activity. So it's really important, I think, to sit down, identify our primary goal, make sure we're all together on that. And you could see in those examples that I shared that each of those programs had, slightly different goals, slightly different populations that they were working with. So you need to make sure everybody's kind of going for the same thing, or at least different aspects of a program are addressing different needs with the different partners that you have. And then in designing a new program, you don't need to reinvent the wheel. I think sometimes we think we have to start all over from scratch all the time. As prescription to being in nature can't really stop when you write words on a prescription pad, right? When you get a prescription, you actually have to, if it's for medication, you have to go to the pharmacy, you have to fill it, you have to read the instructions, you have to take it. So we can't just tell people to get in nature without giving them those next steps or getting a way to fill those next steps. So we have a lot of great nature programs already happening in our state. So in designing a prescription program, I think it would be really important to link to what we already have instead of competing with what's already out there. So that collaborating and connecting with people in our existing organizations like AgriLife Extension, Texas Children in Nature Network, Texas Parks and Wildlife, Texas A&M Forest Service, Center for Health and Nature. These are all places that have programs that we can connect to. So we need to help them, people to stay in nature with regular programming. And that's what a lot of these organizations have to offer, not just like a one-time deal, but an actual program that's extended over time. And in AgriLife Extension, I'm currently working on a program that aims to get families active and outside on a daily basis. So that's going to be coming out next year. Certainly something I would love to have connected to a prescription program. But some of the great programs happening, like with Texas Children in Nature Network and Texas Parks and Wildlife, like Outdoor Families, Nature Rocks, those would be great things that would be connected to a prescription program. And we also need to be creative about what it means to be in nature. Like we saw in that earlier slide, it means different things to different people. And it doesn't always have to be the big weekend camping trip, as great as that sounds. What is recommended and what research has shown is that it's more feasible if we get a mixture of those big doses, the big weekend trip, along with those small doses, like the things we do in our neighborhood or in a local park. So just getting outside on a daily basis, like gardening, walking, watching clouds, looking for wildlife, collecting bugs, all that can get us some of those nature benefits, but just in smaller doses. And it's that combination of big and large doses where you get the big impact. But I think sometimes we think about nature and we think, oh, we have to do something huge, and we don't always have to do the big thing. We can do the small thing too. And then sometimes to get people excited, is to help them overcome some barriers or to find ways to make it more fun. So find ways to incentivize spending time in nature. Even a giveaway like a pedometer, water bottle, a journal. These are some easy ways just to get people out there trying it for the first time. And certainly if you provided a free park pass, it could help to overcome some of the barriers of cost. So this is important to think about, because sometimes in developing programs, we do need some outside support. We do need some funding source to help with providing some of these things and help in creating a program. And so these are just things to think about when you're designing a program. Like what are we going to need to do to give to participants just to get them excited about it? Certainly can help get them motivated. And this is a really important step. We see that evidence-based strategies like tracking our time in nature, or even getting text, like getting some social support, like the example on the cell phone there. These are things that we know can help people get started and stay doing a program. So these strategies really work to get people continuing to do something. Also, technology can be used for evaluation. We can use the tracking and cell phones to just really learn, how are people feeling after they've been in nature? How much time did they spend out in nature that day? So I think it's really important that we use our technology for all of these kind of purposes. And of course, evaluation is such an important part of designing a program. We have to know if it had the impact we wanted it to have. Did it really have a positive effect? Personal stories are really important. And so collecting personal stories, people can record on their phones, they can take pictures. Those things are very powerful in influencing more partnerships and helping with funding. So these are ways you can use your technology to help with a program. And so we really want to see, again, that effect and how we can help Texans become healthier and happier. And I really, really think we need to incorporate technology to do that. And finally, people need to know where they can go to be in nature. So many of the nature prescription programs include these features of finding where to access nature. I love the program from Texas Children in Nature Network in partnership with Texas Parks and Wildlife, Nature Rocks. This could totally be linked to a nature prescription program, helps families find places to play and to explore. So this could be an excellent feature of a program like that, just helping families know where to go. So I'm just wrapping up with a couple of slides. Where does that leave us? Where do we go from here? Well, we all, could go off and try to create our own nature prescription program in our community, and that could be great. I could start something small here in College Station. Somebody else could start something, up in Dallas, and we can see how it goes. I think that's what's being done with a lot of these programs throughout the US. But what I want to just argue for is the benefits of working together to create a statewide program in Texas. A statewide program could be implemented so that it's more equitable. It's a more equitable approach. I think sometimes we focus on certain areas with our programs, but a program that's statewide could reach maybe those hard to reach rural places or hard to reach populations that might not get the programming. Often our best programs are going to the people who don't need it the most. So I think having something statewide could really help with some of that equitable access to programming and equitable access to nature. A statewide program could offer consistent programming instead of some of these small projects here and there with all the different goals and different elements. Having a consistent program, like in a bigger umbrella program, could help with that. We also would have a greater appeal, I think, to funders, more funding opportunities that come from a bigger program. If we're looking at bigger funding agencies like the National Institutes of Health or the CDC, I think a statewide program might have some appeal for that. And we could really show a longer term impact if we have participation across the state, and it could lead to a more sustainable program. Very few of the programs out there have been really evaluated well for program effectiveness. And we are such a big and diverse state. I think a statewide program here in Texas could really be a model for some of the other states and how to do a prescription program. So at Texas A&M, we're in the process. We're trying to get something off the ground, making a statewide program happen. We're currently gathering partners. We're in these beginning stages and working on the design of the program. My colleagues that I talked about earlier and connected to the Texas A&M Center for Health and Nature are now working with the Houston Methodist, and they have plans to work with the Harris County Medical Association in the near future to start launching a program in the spring. So they're going to be piloting in just a couple of communities and then evaluating to see what the effect was, what were the health effects, the health outcomes of the program, and then adapting and editing and making changes so that we can think about launching statewide. So it's exciting that we're moving forward, but this of course all takes time. And like I was saying a few minutes ago, I think partnerships are really key. So if this is something you're interested in, if you would like to join in these efforts, or if you have questions about them, I hope people feel comfortable just reaching out to me. We could certainly talk more about how to include more partners in this process of creating a statewide program in Texas. So I'm just going to wrap up with that. Here is my contact information, my phone number or email. You can reach out to me. I'd love to hear from people, but we have some time left here at the end, and so I'd be happy to answer questions. Here's some comments, and like I said, some of you might be aware of some things happening near you that you want to share with the rest of us. I'm certainly not the expert in everything ParkRx, the nature prescription program. So I'd love to hear what's happening with other people too. So let's just take a few minutes to answer questions and talk some more about it. And thank you all very much for allowing me to present today and sharing with you.
We don't have any questions yet in the chat, so I'll vamp for a second and let folks know. We do have an evaluation for today's webinar. Please take a moment to fill it out. It helps our presenters know how they did, but it also helps Alice and I plan for future webinars as well. So if you wouldn't mind filling that out. And then also, Deborah is going to be doing one of our Wednesday workshops during our summit this year. And so if you're not aware, Texas Children in Nature Network does a summit every year. This year it's going to be December 7th through 9th at the AT&T Center in Austin on the University of Texas's campus. And on the Wednesday of the summit, which is the 7th, we're going to be doing special 3-hour workshops that everyone gets to choose one. It's not like an optional, you have to pay extra for. It's part of the summit, it's included. And so if you want to talk just a minute, do a little brief, I don't know, pitch for folks who might want to register for your workshop.
Yeah, so we're really excited. I'm going to be presenting with Dr. Jay Maddock, who's the director of the Texas A&M Center for Health and Nature. And we're actually going to be taking the group that signs up for our workshop over to Peace Park, which is in Austin. And we're working on finding a fun way to get there, where I think we're going to be able to take some bikes for people who sign up and who want to. We'll bike over to the park. We're going to talk about accessing nature, and some of when we think about accessing nature is that getting to and from nature, right? And so I'll be talking some as we bike and walk there about how we can access and how accessible, you know, we are to nature with means of biking and walking, bikeability, walkability. And then while we're in the park, we're going to talk more about park prescription programs like we talked about today, and just talk about ways that we can how we can access nature for all different populations, different groups of people. And so that's just a little sneak peek as to what we're going to be talking about in December.
Great, and we do have bikes arranged for y'all, so you will be able to bike to that program if you want to. So we do now have some questions. The first one is from Teresa. She asks, how can we stay up to date with the progress of the pilot nature prescriptions program in Texas?
That's a great question. I think what we at Texas A&M, we're connecting regularly with our partners at Texas Children in Nature Network, and so I think this is something where as we move forward, we'll probably want to have some regular updates, and maybe perhaps that's just at the website, or maybe we can have a informal talks or something like that coming up in the future. I think we'll have more updates in December at our workshop. But that's a really good question, just thinking about how we can keep the community at large informed of what's happening. Certainly the Center for Health and Nature website at Texas A&M could possibly have some updates. I'll let my colleagues over there know, that people want to stay informed and find out the best venue for that, the best way to keep people apprised.
Our next comment is from Caroline Cruz, one of your coworkers at AgriLife. And she wrote, I'm hosting a Nature for Health event in Conroe in November. We'll have walk with a doc, forest therapy, and family activities at our state forest. I'm a county extension agent for family and community health. I need to follow up with you, Dr. Kellstedt, on this great program. We have amazing healthcare providers here in my county that believe in nature prescriptions. So.
Yes, I'm very excited about that. Maybe I'll connect with you after the talk here, and maybe I can head over there. That would be great. Awesome.
And then we have a comment from Art. He says, this can apply to all ages, but senior citizens or other folks with potential physical disabilities or access problems should definitely be included. Definitely,
yeah. And again, that idea of, small and large doses, it doesn't always have to be, like I said, these grand, adventures off climbing a mountain. You certainly can access nature in a lot of different ways, but really important to think about how different people are able to access and making sure that everyone's included in accessing nature.
And then we have a question from Karen. He asks, how do you select places to pilot the program?
Yeah, that's a great question. Some of that has to do with opportunity. The Center for Health and Nature right now is partnering with Houston Methodist. It's one of the partners in the center. So that's the natural first step to work with the doctors in Houston Methodist. So you have to sometimes start where your partnerships are, your already formed partnerships, and then you can extend out from there. When I'm partnering with an AgriLife Extension, the way I work is more with the partners who are receptive, the partners who are available. Not everyone has time to start something new or to pilot. They don't have the bandwidth in their community at that moment in time. So sometimes the way I work with partners is I throw out feelers and I say, who might have a community that's receptive right now, that, has a school district or providers or a healthcare system that's kind of looking to do something right now. And if you do, then maybe your community might be the one that wants to work with us in piloting. So in the program that I'm developing, I'm working in Central Texas with a school district that was just really receptive, and they were and used to have a good connection to their state parks and nature programming with the school, and then it kind of died down, and now they want to get back started again and get excited about it. So they were really into the idea. So for me, connecting to partners and piloting has to do with, kind of who's ready to do it right now.
Great. And then we have another question from Teresa, which I think is a follow-up to her question earlier about how can people stay up to date. She asks, would y'all be willing to start an email list of people who would be interested in the progress and participating?
Yeah, let me, why don't you reach out and email me, and then I can talk about how the feasibility of that, and anyone else who's interested, shoot me an email. And perhaps that we could do something that way where we just have some regular updates of what's happening, and maybe ways we can reach out to partners, what we might need, feedback we might need from people. So note my email address on the screen and go ahead and send me an email about that.
Great. That is currently our last question. I will do a plug that I think from some of the questions we've seen for our next webinar, I think would be really interesting to folks. Our next webinar is on October 12th, and it's called Disability, and it is how to integrate nature and accessibility. And so I encourage you to register for that upcoming webinar as well. So thank you so much, Dr. Kellstedt, for all your time today. We really appreciate you being willing to present.
Thank you. Thank you, Sarah, and thank you all. This was a great talk today, and I appreciate everyone's attention, and I look forward to connecting more in the future.
Thank you so much, and everyone have a fantastic rest of your day.